And welcome back to the cross-examination in court of the nurse Lucy Letby. Just as a reminder before we start today, Lucy Letby is currently standing trial accused of the murder of 7 babies and the attempted murder of 10 others at the Countess of Chester Hospital's Neonatal unit. She has pled not guilty to all charges. Nicholas Johnson KC for the prosecution now moves on to the case of Child O. Letby, in her defence statement, said she did nothing to hurt Child O. She noted a change in Child O's appearance, but it was not dramatic. He had a deterioration, and Letby noted Child O's abdomen was red and distended. She said she didn't notice a rash on Child O, and no one mentioned it. She said the abdomen was very swollen, and there was a struggle to get lines in. Letby tells the court one of the lines had tissued. She said one of the doctors had gone out to smoke a cigarette during the time of Child O's resuscitation, and when that doctor returned, they did not wash their hands. Letby is asked by Mr. Johnson if there is anything she wishes to change in her account of evidence so far. This is a question Mr. Johnson asks at the start of most sessions during the cross-examination. Letby says there is nothing she wishes to change. Letby agrees with Mr. Johnson it was big news to see naturally conceived twins on the unit, as it was a rare occurrence. Child O and Child P were 2 of the 3 triplets. Messages are shown to the court between Letby and colleague Jennifer Jones-Key from June 22nd. Letby confirms when she is back to work, adding, quote, "Yep, probably be back in with a bang, lol." Mr. Johnson says within 72 hours of that message, 2 of the triplets were dead and Child Q had collapsed. Letby is asked why she was so interested in the triplets. Letby tells the court there was general conversation between staff colleagues as it was something unusual on the unit. She accepts that all went well with the birth and accepts the triplets had been doing well, with Child O being fine. Letby accepts that Child O was doing well on the night shift of June 22nd, 23rd, and had been moved off CPAP onto Optiflow breathing support. Letby accepts her colleague Sophie Ellis's description that there was nothing concerning about Child O's presentation. Letby is asked to look at an observation chart for Child O for June 22nd to 23rd. There is a reading which, the court is told, appears to have been changed from 1430 to 1330. Letby says Child O's temperature is a little unstable in the hours prior to 1:30 p.m. on June 23rd, but accepts he was otherwise stable. The court is shown a lab result that there was no bacterial infection in a blood sample taken on June 23rd for Child O. A feeding chart showed Child O was, quote, tolerating his feeds very well. Mr. Johnson says Letby agrees. In her legal defence statement, Lucy Letby said she didn't believe that a problem with Child O's abdomen was dealt with adequately. Nicholas Johnson KC now asks her what the inadequacy was. Nurse Letby says she doesn't know. Mr. Johnson asks Letby where the problem is for Child O's abdomen that she had said was not dealt with, as there is no data to show that. Letby says after looking at the data, she does not know what the problem was. Mr. Johnson says there is no problem shown in the paperwork. Letby says there was, quote, no formal note made. The court is shown Sophie Ellis's note at 7:32 a.m, quote, abdo looks full, slightly loopy, appeared uncomfortable after feed, Reg Maybury reviewed. Abdo soft, does not appear in any discomfort on examination. To continue to feed, but to monitor. Letby says the doctor did not formally record it. Letby accepts the review was carried out at 9 a.m. and Child O's liver was reviewed, finding no injury. Letby accepts the liver injury happened on her watch. She says she accepts it happened on her shift, but she does not know how it happened. A shift rota for June 23rd is shown. Letby was designated nurse for 2 of the 3 triplets in room 2, Child O and Child P, plus 1 other baby. The 3rd triplet was in room 1 with 2 other babies. Letby rules out staffing levels as a contributory factor in Child O's collapse or death, or staffing mistakes. Letby says Rebecca Morgan was a student nurse on the unit. She accepts that the student nurse would not always be in room 2 and would sometimes be chatting to parents. Letby says the 2 triplets Rebecca was designated for were in the high dependency room, and if Rebecca left the room for a period of time, she would have asked someone to keep an eye on them. A note by Dr. Cook at 9:30 a.m. is shown to the court, which included, quote, "No nursing concerns, observations normal." Letby says she left the unit at one point to get donor milk for the babies. Letby is shown a series of text messages between herself and a doctor prior to 9:30 a.m. Letby expresses disappointment in the message that the doctor will not be on the unit. Quote, "Boo." Letby says she got on well with the doctor. Letby asks if the doctor would be on the unit in the afternoon in the message. She adds, quote, "My student is glued to me." She adds, quote, "Bit rubbish that you couldn't stay on NNU." Mr. Johnson asks if Letby was missing him. Letby replies this was her first day back from her Ibiza holiday. Letby sent a message at 9:55 a.m. Quote, "I lost my handover sheet, found it in the donor milk fridge. Clearly, I should still be in Ibiza." Letby is asked if it was a busy morning for her. She says, reasonably, not exceptionally. Letby is asked how she finds the time to text when at work. She says she would not use her phone at the cot side or a clinical area, but would use her phone elsewhere on the unit. A feeding chart for Child O is shown to the court. Letby is recorded as signing for feeds at 10:30 a.m. and 12:30 p.m. She says the writing above is not by her, but by Rebecca Morgan. She says if she has signed, then Rebecca would not need to. Letby denies feeding and overfeeding Child O. Nurse Melanie Taylor at about 1 p.m. entered room 2 and said, quote, "He doesn't look as well now as he did earlier. Do you think we should move him back to room 1 to be safe?" Letby declined. She said she doesn't remember being very dismissive. Melanie Taylor had told the jury she felt Letby was, quote, "undermining her authority." Letby replies, "That's Mel's opinion." She adds that Melanie Taylor had the right to override that and take Child O off her. Letby denies she had sabotaged Child O, or that this would have meant Child O would have escaped her influence. Nicholas Johnson: "You'd sabotaged baby O, hadn't you? And that's why you didn't want him moving out of your control to nursery 1. Letby replies, "No." Nicholas Johnson: "This would have meant baby O escaping your influence, wouldn't it?" Letby replies, "I disagree." Nicholas Johnson KC suggests that Lucy Letby made false entries on a nursing chart to show that baby O was given some ventilation known as CPAP. He says the baby didn't receive this. Nicholas Johnson: "You were covering for air you'd given him, weren't you?" Letby replies, "No." An X-ray report for Child O is shown to the court, including, quote, "moderate gaseous distension of bowel loops throughout the abdomen." Letby is asked why she wrote CPAP in her notes. Letby replies, "I can't answer that now. I don't know." Letby says she does not know if Child O might have been on some CPAP pressure via Optiflow. Letby is asked about messages exchanged between her and a doctor when at 2:30 p.m. she was recorded as taking observations for Child O. The messages were sent at 2:20 and 2:23 p.m. Child O collapsed shortly after 2:40. In her defence statement, she said the doctor colleague was on the unit at the time. Swipe data shows Letby has arrived on the neonatal unit from the labour ward at 2:39. Letby says she cannot say definitively where she was at the time. She denies nipping out of the neonatal unit to make it look like she was elsewhere at the time of Child O's collapse. The doctor's note is shown to the court, quote, "Call to see Child O at 14:40, desaturation, bradycardia and mottled." Letby says she believes she called the doctor to the nursery room. She denies it was to get personal attention. Letby says it was because he was there to assist Child O. Letby says a 20ml saline bolus was given to Child O in response to a poor blood gas record. She says there was a delay as there was an issue with getting the line for Child O. She says she believes the bolus, which has a time started of 14:40, was in response to Child O's collapse. A doctor's note recorded for the 14:40 collapse states 10ml 0.9% sodium chloride bolus already given. Letby agrees the 2 desaturations for Child O that day were profound ones. Letby's note adds, approximately 14:40 Child O had a profound desaturation to 30, followed by bradycardia, mottled ++, and abdomen red and distended. Transferred to nursery 1 and neopuff ventilation commenced. Perfusion poor. Letby, when questioned, says babies would frequently desaturate to this level, and this happened prior to June 2015 and often. Letby says the redness to the abdomen on child O was abnormal and the description of mottling was normal. Mr. Johnson says during the intubation, Dr. Stephen Breary, in evidence on March 15th, said child O had a rash on his chest, on the right-hand side about 1 to 2 centimetres in size. He said it was an unusual rash that was initially purpuric and it later disappeared. Letby says, quote, "I don't believe that's what I saw. I saw mottling. If that's what Dr. Breary saw, then if that's what you could take as being true, then yes." Mr. Johnson says when the doctor went to see child O's parents and during that time, child O desaturated again for the final time. Letby says she does not remember this declining moment, but said she put out a crash call. Quote, "I remember the death, but not this precise moment where he declined and I put out a crash call." Child O was intubated and efforts were made to resuscitate him. Letby says she did not recall seeing the rash disappear. She says she did not see what Dr. Breary and Dr. Ravi Jairam had seen. Letby says she did not pull an NG tube out of child O's stomach. An X-ray report for child O is made at 4:46 p.m. It records, quote, "NG tube in situ with its tip close to the cardia. This should be advanced by 10 to 15 mil." An earlier X-ray report said the NG tube was, quote, "in a good position." Letby says a dislodged tube would still drain, as it would still be in the stomach. Letby says the tube could be moved during the intubation process at 2:40 p.m. Mr. Johnson says child O's mother, in agreed evidence, said her baby was, quote, "changing colour with prominent veins." She says she later saw that in child P. Letby says she didn't see that herself. The father of child O said, quote, "You could see his different veins. It looked like he had prickly heat, like something oozing through his veins." Letby says she did not see anything like that. She accepts she saw a red purpley blotchy rash and a red abdomen. In police interview, Letby said she believed she had done chest compressions and drew up some drugs. Letby says after looking at records, she now believes she was just involved in medications. Mr. Johnson suggests Letby is distancing herself from the CPR so it could not be said she caused the liver injury to child O. Letby denies this. Letby says she does not know how child O got the liver injury. Letby denies injecting air into child O to cause an air embolus or inflicting a liver injury on him. Nicholas Johnson: "These things all happened on your watch, didn't they?" Letby replies, "Yes." Letby says she disputes an account that Dr. Breary told her not to come in after that shift. Nicholas Johnson: "Were you bothered by what you'd witnessed?" Letby replies, "Of course I was bothered." Messages are shown between Letby and the doctor from 9:14 p.m. on June 23rd. Doctor, quote, "Your notes must have taken a long time. Had you documented anything from this morning?" Letby replies, "Only a little. Had the other two to write on as well, and sorting out the FFP, etc. Left signing for drugs until tomorrow." A nurse also messaged Letby, quote, "F in hell, what happened?" Letby replies, "Can't think straight, so took a while. Blew up abdomen, think it's sepsis. Had big tummy overnight, but just ballooned after lunch and went from there." Letby tells the court that is what she said, having been reviewed by a doctor, and that child O had a loopy bowel. She says she is referring to the stension found prior to 8 a.m. Lucy Letby at 9:33 p.m, quote, "Worry as identical." Mr. Johnson: "Were you setting up a false narrative here?" Letby replies, "No, that's not what I'm suggesting at all." "You had already set your plan in motion by pumping air into child P before you left." Letby replies, "No." Letby is asked to look at a DATIX form she had written. This is a form used by staff when issues have been highlighted, such as clinical incidents. The form said, quote, "Infant had a sudden acute collapse requiring resuscitation, peripheral access lost." Dr. Breary said the information in the form was untrue, and he said he didn't believe at any point IV access was lost. Asked about this, Letby says, quote, "Well, that's Dr. Breary's opinion." The form adds, quote, SB Brewery wishes amendment to incident form. Patient did not lose peripheral access. Intraosseous access required for blood samples only. Letby says she does not believe her Datix report was untrue at the time. Nicholas Johnson. You were worried that they were onto you, weren't you? Letby replies, no. Mr. Johnson turns to the case of Child P, triplet brother of Child O. Letby, in her defence statement, denies hurting Child P. She said she did not recall having an argument with nursing colleague Catherine Percival Ward about working in room 1. She said she was in conversation with student nurse Rebecca Morgan when Child P collapsed. She said it was, quote, chaotic with all the staff arriving to resuscitate and Child P was too poorly to be transferred to room 1, so was kept in room 2. Child P's stomach was, quote, red. She says at some stage she pricked herself with a cannula needle and needed to go to A&E for treatment. While there, she said she fainted, she believed due to stress and the fact she hadn't eaten. She said she had forgotten she had taken a handover sheet home with her. An examination of Child P at 10 a.m. on June 23, 2016 was, quote, unremarkable, the court hears. Letby accepts that. She adds there was nothing of note during that day. Mr. Johnson suggests Child P worsened after Child O passed away. Letby agrees. A 6 p.m. feed for Child P is signed by Letby, and she says the writing above is not by her. Dr. John Gibbs had reported in his 6 p.m. review for Child P that the baby boy was doing well. A blood sample taken at 6:35 p.m. taken to a lab showed no signs of infection. Letby denies overfeeding Child P at some point between 5 and 8 p.m. on June 23rd. Letby agrees there were no problems at the time of the handover for Child P on the night of June 23rd. She recalls the X-ray taken shortly after that handover. The X-ray report said, NG tube in satisfactory position, gas-filled bowel loops throughout the abdomen, through to lower rectum, with no evidence of obstruction and no plain film signs of perforation. Letby denies pumping Child P with air. She agrees this was a deterioration for Child P. Medical expert witness Dr. Owen Arthurs had previously told the court this image was quite unusual for a baby of that gestation. Letby says she cannot comment how the gas got there, only that she did not put it there. A 14mm aspirate is recorded for Child P at the time of the handover at 8 p.m. Nicholas Johnson. That was your doing, wasn't it? Letby replies, no. On your way home you were sowing the seeds with your colleagues. Mr. Johnson refers to the, quote, worry as identical text message Letby had sent. You were feeding a false narrative trying to divert attention away from your homicidal activities. Letby replies, no. 5 ml of air and 2 ml of milk is aspirated from Child P at 7 a.m. Mr. Johnson asks, how much milk had Child P been fed overnight? Letby said Child P had been fed prior to midnight. She says if the NG tube is in the stomach, air would come out. Letby disagrees that Child P was well at the morning handover time, as Child P was nil by mouth. However, in a police interview, Letby had earlier said Child P was stable and well. Mr. Johnson suggests Letby is deliberately making the appearance of Child P being worse now than at the time she gave her police interview. Letby responds, no. The day shift for June 24th is shown to the court. Student nurse Rebecca Morgan is on the rota. Lucy Letby is the designated nurse for Child P in room 2. The other surviving triplet is also in room 2 with the designated nurse Christopher Booth. Child Q is in room 1 with 2 other babies. 3 babies are in room 3 and 3 babies are in room 4. Letby rules out staffing levels as a contributory factor in Child P's collapse and death. She also rules out staffing mistakes. She says there were some issues with the chest drain, but cannot say how much of an effect that had on Child P. By 6:39 a.m, Sophie Ellis's nursing note recorded that abdo has been soft and non-distended, 25 ml of air aspirated by SNP Kate Ward, NGT placed on free drainage. Mr. Johnson says Letby created a false nursing note at 8 a.m. to say, quote, abdomen full, loops visible, soft to touch. He says that is not the picture from 6:39 a.m. Letby agrees that is not the same as Sophie Ellis's note. Sophie Ellis's note for June 23rd for child O states, abdo looks full, slightly loopy, abdo soft. Letby says her observation for child P that morning was what she saw. She informed the doctor an hour later about the abdomen observation. She denies a suggestion by Mr. Johnson that she is lying. Letby says she escalated the observation to the shift leader. Mr. Johnson asks if Letby knew what she was telling her friend, the doctor, at this point. Letby does not recall. The message shown to the court sent at 8:04 a.m. quote, I've got child and child P. Child P has stopped feeds and large asps. Mr. Johnson asks why Letby is lying about having the first child, whose designated nurse was Christopher Booth. Letby says she would have to check the paperwork as she may have been assisting. Letby's follow-up message at 8:19 a.m, quote, I'm okay, just don't want to be here really, hoping I may get the new admissions. Mr. Johnson asks why Letby didn't raise it with the doctor colleague who was coming into work. Letby says the doctor was not present in the neonatal unit that day. He went to the children's ward. Letby denies the observation was a fabrication, as Dr. Anthony Yuko saw the loops as well. She said the context of, quote, don't want to be here really, was what she had seen earlier with child O. Mr. Johnson refers to Dr. Yuko's note of observation at 9:35 a.m, quote, abdomen moderately distended, bloated, soft. Mr. Johnson says there is no mention of loopy bowels. Letby replies, no. Letby says Dr. Yuko might not have recorded it. Nicholas Johnson, or you have misrecorded it. Letby replies, no. Within a few minutes of Dr. Yuko reviewing child P collapsed. Nicholas Johnson, that has to be your doing, doesn't it? Letby responds, no. Mr. Johnson says Rebecca Morgan's evidence was that Letby had left the room at the time of the collapse. Letby says from her recollection she was in the room and is quite clear on that. Letby's note for the desaturation, quote, child P had an apnea, brady desat with mottled appearance requiring facial oxygen and neopuff for approximately 1 minute, abdomen becoming distended. Mr. Johnson says the note is deliberately written to make it look like the neopuffing made the abdomen become more distended. Dr. Yuko, the court is told, gave evidence to say child P was in a very different condition between 9:35 and 9:40 a.m. He also said Letby was very keen for the doctor colleague to be called. Letby says this was because he had been present for child O's deterioration. She adds it was one of the other doctors who suggested getting that doctor. Nicholas Johnson, were you trying to attract the doctor's attention? Letby replies, no. Did you enjoy being in these crisis situations with the doctor? No, the doctor colleague and I were friends. Was it something to share between you? Letby responds, no. Child P desaturated again at 11:30 a.m. He was given adrenaline and he was paralysed with a drug to aid ventilation as he had been fighting the ventilator with his breathing. A note in Letby's handwriting is shown to the court. It details the efforts to resuscitate child P. It was found at her home. Lucy Letby, I collect paper and that's where it ended up. I have difficulty with throwing anything away, particularly paper. Is there anything comforting in keeping the paper? Letby responds, I keep paper, yes, from a variety of different sources. Letby clarifies she does not include bank statements in that. Letby was recorded by a nursing colleague as saying for child P, quote, he's not leaving here alive, is he? Letby disputes that, quote, I don't recall the conversation. Child P's final collapse happened at 3:14 p.m, just after doctors had reviewed him. Letby says she cannot recall shouting for help and cannot recall child P's breathing tube being dislodged. Nicholas Johnson, the problem happened just after everybody left, just after you had said he's not leaving here alive, is he? Letby replies, I don't agree I said that. Is this another case of bad luck, that it happened just after everybody left? Letby replies, yes. Did you enjoy making predictions when you knew what was going to happen? Letby replies, no. You were very excited in the aftermath of Child P's death. Letby responds, no, I was not. Mr. Johnson says a female doctor colleague had said she acted in a totally inappropriate way. Letby replies, no, I didn't. Letby says she told colleague Sophie Ellis out of respect what had happened. Mr. Johnson said Sophie Ellis had been to the races. Why not leave her alone? Letby said Sophie Ellis had texted her first. Nicholas Johnson. Did you enjoy the drama? Letby replies, no. Your portent of doom had fulfilled itself, hadn't it? Letby replies, no. At your hand. Letby replies, no. Mr. Johnson now turns to the case of child Q. Letby, in her defence statement, said she cannot recall much from the shift given what had happened in the previous days. She said she did not understand why feeding was continued for child Q when it was not being digested. Letby said child Q was sick, and when she arrived, from the records, she aspirated, quote, air +++ from child Q. She says she does not know how the air got there, and she did not cause it. Child Q was not put on a ventilator as there were concerns over NEC. She did not deliberately retain a handover sheet for child Q. Mr. Johnson says child Q was transferred to nursery room 1. Nicholas Johnson. He was in a serious condition after that, wasn't he? Letby replies, no, I disagree. He needed one-to-one care, didn't he? Letby replies, yes, he was assessed ITU care. The rota for June 25th, 2016 at the beginning of the shift is shown to the court. Child Q was in room 2, designated nurse Lucy Letby. One other baby is in room 2 with a different designated nurse. Letby was a designated nurse for a baby in room 1. 2 other babies are in room 1 also. 3 babies were in room 3 and 4 babies in room 4. Nurse Mary Griffith had designated babies in rooms 2, 3 and 4. Letby rules out staffing levels or staffing mistakes or medical incompetence as contributory factors for child Q's collapse. Letby agrees child Q required some breathing support at birth. She also agrees child Q made good progress after birth according to Mr. Johnson. Letby says, quote, other than some temperature issues, the overall condition of child Q was positive. Child Q was looked after by Samantha O'Brien on the night of June 24th, 25th, and child Q was being fed 0.5 ml of milk every 2 hours at 3, 5 and 7 a.m. A blood gas reading at 6:58 a.m. was, quote, very good. Letby adds there had been a slight increase in the lactate and the pH reading was slightly lower, but accepts it was a good reading overall. Letby said at the time of child Q's handover on the morning of June 25th, there were concerns for his abdomen and his feeds. Asked who else had raised these concerns but her, Letby replies, she doesn't know. Letby had previously told her defence that due to temperature concerns and aspirates, she wanted child Q to be reviewed by doctors before feeding at 9 a.m. on June 25th. The neonatal schedule shows Letby made observations for the designated baby in room 1 at 8:30 a.m. She also co-signed for medication at 8:32 to 8:34 for a baby in room 3. At 9 a.m, Mary Griffiths is doing observations for a baby in room 2. An unsigned entry is made for Letby's designated baby in room 1 at this time. Also at this time, Letby is recorded doing observations for child Q. Letby says she does not recall doing the observations or being interrupted. Mr. Johnson says he uses the word interrupted as swipe data shows Mary Griffith entering the neonatal unit at 9:01 a.m. He suggests Letby pumped child Q with some clear liquid while Mary Griffiths was out. Letby denies this. Letby is asked why she has only done half a job for the 9 a.m. June 25th observation for child Q. Letby replies, I can't explain why I haven't filled the saturations. You were interrupted by Mary Griffith, weren't you? Letby replies, no, I don't know why those weren't filled in. Letby said she left room 2 to go to room 1 as she needed to attend to cares for the other designated baby just after 9 a.m. Mr. Johnson says that is a lie. Letby says the baby didn't need a nappy change, but that baby was an intensive care baby who needed regular attention. Letby agrees she had not filled in the saturation readings, but otherwise the job was done for child Q's 9 AM observation. Letby says she was not present in the room at the time child Q vomited. She says she cannot recall aspirating air from the NG tube afterwards, but may have done so. Letby's nursing note states, mottled ++, neopuff and suction applied, air ++ aspirated from NG tube. Letby says that information may have been relayed to her. She says the air in child Q might have come from the neopuffing process. Letby agrees it could be dangerous if the neopuffing and suction was done if there was clear liquid in child Q's system. Letby said child Q had vomited over his bedding. Child Q, in a doctor's notes, had, quote, just vomited and his oxygen saturation dropped to the low 60s. Nicholas Johnson. There was a concern that child Q had inhaled some liquid, wasn't there? Letby replies that is a concern any time a baby vomits. The doctor's observations for child Q continue for 53 minutes. Nicholas Johnson. This was no everyday minor desaturation, was it? Letby replies it was not serious enough to require an emergency crash call. Nicholas Johnson replies, you pumped him with a clear liquid, didn't you? Letby responds, no. Messages sent to a nursing colleague from 1:13 PM are shown to the court. Quote, child Q on CPAP. Mina has taken other baby off me, so just got him. Almost had a tube earlier, but gas is improving. Letby denies the event was trivial, saying child Q had deteriorated, but it was not on the same level as the other events that have been discussed, and did not need a crash call or resuscitation efforts. Nurse Amy Davies recorded on June 25, 2016 for the night shift that child Q had, quote, settled. Nicholas Johnson. He became much better, hadn't he? Letby agrees. A child that was put in your hands in good condition left your hands in a ventilator in intensive care, but by this time was returning to normality. Letby says by the night shift child Q was still on a ventilator and had a poor blood gas record at 6:23 PM. You had nearly killed him, hadn't you? No, I hadn't nearly killed him. Letby says she was later concerned she was being blamed for something that did not happen by leaving the nursery room unattended. Nicholas Johnson. The truth is that you pumped him, child Q, with liquid and air. Letby replies, no, because you tried to kill him. Letby replies, no, I didn't.